Because I would presume a lot of what I told you about why I like hospice.
Yeah, that all was really good.
Okay.
I kind of wish I had been filming that part.
All right.
But yeah, anything kind of similar to that is great.
Okay, great.
Okay, so let's just start with who is a good fit for hospice, so who should be referred to hospice as a patient?
So hospice is a good fit for people who have two basic qualifications. One is if they are coming towards the end of their life, typically within the last 6 months of their life. And then the other aspect of that is someone who is interested in pursuing what's called pure palliative care. Excuse me. So, meaning specifically that we're interested in pursuing comfort for the most part only, and not aiming towards getting curative, or not towards curative measures, but looking more towards comfort than anything else. Those are the major folks that benefit the most from hospice care.
Okay, great. As a family member or as a patient, how do you know when it's time for hospice care?
So typically, when you start to see a decrease in function, and when I mean function, I mean being able to do things for yourself.
Oh, real quick, let me interrupt you. Could you repeat the question in your answer as you go? So,
oh yeah, sorry. Okay.
As you yeah.
Yeah, gotcha. Okay. So, as a patient or a family member, how do you know when it's time for hospice? Well, that's hard, and it depends on the diagnosis. But generally speaking, is when you see a decrease in function. And when I say function, I mean being able to do the basics of daily living, or what we call activities of daily living: dressing, eating, walking, going to the bathroom, taking care of yourself, brushing your teeth, combing your hair. As those things become more difficult, and as people spend more time at rest, more time in bed, as a result of their illness or a chronic illness, that's typically the time when hospice should be considered. And a hospice or a palliative care provider can help to decide if a patient meets criteria for hospice.
Perfect. Okay, and what services can hospice include? And then you can go ahead into the custom nature and the team aspect of hospice as well.
So, what services does hospice include? What do we do? It's actually quite vast, and so one of the things that is pretty well has to be said before I can answer that is that we focus on people's suffering, and helping to relieve that suffering. And as a society, and even in being a physician and in medicine, we tend to think of that as a physical thing. And indeed, there are definitely physical symptoms like pain, shortness of breath, nausea, vomiting, lots of different things that make people suffer, particularly at the end of their life. And that's one thing we can definitely address, and that's one of the things that is my expertise. But I certainly can't do it alone. And the way we approach hospice is we approach hospice through a team approach. We have something called an interdisciplinary team, and the IDT. And the IDT consists of me as the medical director. We have fantastic nurses that help provide the bedside care to our patients. Then we also have other members. We have social workers. Social workers help to explore the psychosocial aspects of people suffering and how we can help to relieve that. And then one area that a lot of folks have significant suffering with regard to is spiritually. And so a huge part of our team is our chaplains. They help to address a lot of concerns that people have at the end of their life that ultimately leads to suffering, and helps to relieve that suffering by addressing those concerns. We also have other members of the team that are just as important. For example, we have home health aides and nurse aides that help to take care of our patients' basic needs, bathing, taking care of hygiene. And I say that they're extremely important and a significant member of our team because they help to preserve dignity. And one of the things that hospice does is we help to release suffering, but we also help to preserve a person's dignity as they enter this extremely difficult time in their life.
Excellent. Okay, and then finally, if you want to just talk about Cura in general as a hospice provider and what sets them apart.
So, I've worked with other hospices before. I chose Cura, and what sets Cura apart really is the quality of the professionals that we have working, and really the compassion. I've had negative interactions with other hospices in my past where one of those two things or both of those things were lacking. And if you're going to run a hospice that truly is patient-centered and truly cares about the patient themselves, you need to have those two aspects, and we embody them significantly. My nurses are excellent. They learn. We teach each other, and they take that information that I'm able to teach during. We meet weekly to discuss our patients, and they take that information, and they have a lot of experience, nursing experience. Many of them have a lot of hospice experience previously, and they can provide excellent care to patients as a result of that. And the compassion is just absolutely it's astounding. There's been many a tear shed during our meetings. There's been many a reflection that we do, not only to help us take care of our patients, but also to take care of ourselves, because there is such compassion and such emotion that drives this practice. And that's something that we embody. We do the right thing for people, and unfortunately that doesn't always happen, and that's not something that's specific to hospice, but in healthcare in general. But Cura, we do the right thing for the person that needs to be done, and that's really important, and that's what sets us apart from other hospices, and that's why we're growing like leaps and bounds. And it's a good thing, because we can get quality palliative care out there to the Tulsa market or the Tulsa area, and do so very well.
Excellent.